Was that we inspected the patient while entering the clinic, his body gait, posture, his balance, the nails color is pinkish, slightly bluish, but because his hands are cold. Okay, pressure, and then we release the pressure, the pink color will come back again, so it's normal. Can I see your nails, please? The nails, the form is normal also. They are smooth, no pitting, no ridging, no dysplasia. The structure is normal, the concavity is normal, and the convexity of the nails, everything is normal. The skin of the hands, general look at the skin of the hands will show that the skin is within normal limits. I cannot see any obvious skin lesion. Then we move to the examination of the head and neck. Looking at the head form and shape is within normal limits. There is no obvious difference or change in the skull shape, no changes in the structure obviously seen. After looking at the general appearance of the head, we look at the eyes. And can you put your head back, please? We look at the eyes. There is no obvious variation from normal, like increase the distance between the eye pupils. They are within normal limits. And in another record, we will demonstrate the cranial nerve function and examination. I can see that the movement of the eye is within normal limits. Can you follow my finger here? Okay. Looking at the ears, the skin of the ears and behind the ears, because we look for first we look at the shape of the ears, if they are deformed, so this may be part of a syndrome. And if there is any lesion like basal cell carcinoma or squamous cell carcinoma in the elderly people who are sun exposed, or if there is any other skin lesions. This is one ear, let me see the other, okay, and the other. So both are fine. Now we examine the eyes, the sclera and the conjunctiva. The sclera is slightly reddish, so we ask the patient if you have allergy, if you did not sleep well last night, if you have any disease in your eyes that you are following your doctor, or you are visiting. No? No. Okay, they are normally like this? Okay, then we look at the conjunctiva itself, and it should be pale pink. It's not white, not red. But I see it now, it is dark pink. So I think there is some kind of allergy going on with the conjunctiva of this patient, and I think he might need to visit a physician just to check for the reason for that and the appropriate treatment. Okay, now the skin of the face. Looking at the skin of the face, do we see lesions, scars, acne, any laceration, ulceration, any swelling? I can see some acne here, another acne here, so I will write down in the form mild acne. Why it is important to write all the findings on the skin? Because the lymph node examination might correlate with the findings. We might find reactive lymph nodes reactive to the acne or the other lesions present on the skin. So I look at the skin of the face, the skin of the neck, the skin of the ears. Okay, the symmetry of the face. Now for the symmetry, I need to go either directly in front of the patient or I go behind the patient. So on the dental chair, we cannot stand directly in front of the patient. We have to go behind the patient. Okay, and we lower the dental chair. Now I put an imaginary line in the midline of the face. Okay, I draw it imaginary, and then I start comparing each part of the face on the right with the left. I look frontal with the frontal, eyebrow with eyebrow, cheek with cheek, zygomatic bone with zygomatic bone, angle of the mandible with the other one. So every single part of the right side is compared with the left side. There is no asymmetry, no obvious asymmetry. Mild asymmetry is acceptable. It is fine to find some mild asymmetry, but obvious, no. If I find a swelling, for example here, if I found the angle of the mouth or whatever region is different than the other, I have to record down all the details of the finding. Okay, so now for the symmetry, the face is symmetrical. I look now at the profile of the face. Okay, after symmetry, the profile of the face, if it is slightly convex, straight, or concave. And I see the patient is like a class 1 or slight convex. I look at the lips, if the lips are competent or incompetent or potentially competent. This is important because for patients who have incompetent lips, this means that there's mouth breathing or there is continuous dryness of the gingiva, which will lead to increased inflammation of the gingiva or abnormal excessive inflammatory response from the gingiva to the plaque because of the excessive dryness. So now the patient is having symmetrical face, class 1 profile, and competent lips. Okay, now we will go to the TMJ, and for the TMJ we need to stand behind the patient. First, we use inspection. We look at the TMJ. There's no swelling or no redness in the area. And then palpation. I locate the TMJ by putting my fingertips 1.5 centimeters in front of the tragus of the ear. This is the tragus, 1.5 centimeters. It will be about here. And then I ask the patient to open and close. Open. Now please open and close 5 times to the maximum opening and close back. maximum أكتر. أيوة كمان على الآخر. more. Okay, so now I was observing and palpating at the same time. For the palpation, I did not feel any click or extra movement of the condylar head. For the inspection, I was looking at the maximum mouth opening and at the deviation or deflection of the mandible. There was no deviation, no deflection, and the mouth opening was within normal limits. The maximum, the normal range of the mouth opening is 35 millimeter to 50, or 3 fingers, at least 3 fingers from the patient fingers. He can place 3 fingers inside the mouth while it is maximally opened. Can you try? افتح الآخر. أيوة. Yes. So his mouth opening is normal. Now let us look at the lateral mandibular movement. Move your mandible right and left laterally. افتح. أيوة. نص فتحة. يلا حرك يمين ويسار. Yes. He can move to both sides. There's no restriction in one TMJ. Okay, this is called the extra-auricular examination of the TMJ. The intra-auricular examination is that you use the little finger, you place it inside the ear, and you palpate the head of the condyle, and you ask the patient if there is tenderness of the TMJ. Open and close. Close, open. Come on. Okay, في ألم? No tenderness. Okay, now this is the intra-auricular, is an extra and intra. If we have a stethoscope, we can do the auscultation examination. We can put the stethoscope سماعة نحطها على ال TMJ, and then we listen to the clicks or pop or crepitus. And we should differentiate between these 3 sounds. Crepitus, it is like 2 rough surfaces causing friction over each other. The click is when you have just sharp single sound. And the pop is the sound, it's similar to the click, but it is used to describe the movement of the condyle at the maximum mouth opening when the condyle go out the glenoid fossa. It gives one strong sound. نسميه pop. Okay, we finished with the TMJ. Now we'll go to the lymph. Before lymph nodes, we finished the muscles of mastication. For the masseter, we ask the patient to clench, and then upon clenching, I can identify the anterior border and the posterior border of the masseter. I palpate the insertion at the angle of the mandible, and the origin and the zygomatic arch. There is no swelling. They are both symmetrical. Sometimes you find a hypertrophic masseter muscle, larger, yani one side larger than the other. So in this case, both are having the same findings. Okay, for the temporalis, we palpate the fan-shaped temporalis muscle on the lateral part of the skull. Is there any pain? في ألم؟ لا. ولا في ألم هون? Okay, there's no tenderness and they are within normal limits. We start now with the lymph nodes. We start with the pre-auricular lymph nodes. Pre-auricular lymph nodes, these are the lymph nodes anterior to the tragus of the ear. Okay, I palpate with the pulp of my fingers, rounded movement. I don't feel anything. Normally we don't feel the lymph nodes, and if we feel them, they are the size of a pea, a small pea, أو زي حبة العدس تقريبا normally. Usually we don't palpate them if they are not enlarged. We have also the parotid lymph nodes, slightly more anterior to the pre-auricular. They are superficial to the parotid gland, and we have another group deep embedded within the parotid gland. So palpate the pre-auricular and slightly more anterior. We have even the facial lymph nodes, but normally we don't palpate them. They are the infraorbital and the buccal and the supramandibular. They are not palpable usually, and we don't palpate. So start with pre-auricular lymph nodes, parotid lymph nodes, then go to the post-auricular lymph nodes. They are also called the mastoid lymph nodes, and if there is any tenderness over the mastoid process, في ألم هون, okay, and then go to the occipital lymph nodes in the midline of the skull, posteriorly. You go to the bulge of the skull here. It is just below it. They are in the midline. There is nothing palpable. Okay, now I look at I examine the submental. I ask the patient to sit in the upright position. هيك عدل الجلسة لو سمحت. لا, I ask the patient نزل الchin لتحت. أيوة. إذن upright position and tip the chin slightly toward the chest. I come from behind the patient and palpate, or from in front. Both are okay. I palpate the submental. I don't feel anything. Now I palpate the submandibular of the right side. There are different methods, but one of them that I follow is that I ask the patient to tip his head forward and to the side I am examining. And then with the pulp of my fingers, I take the lymph nodes and palpate them against the inferior border of the mandible, meaning I put the lymph nodes between the pulp of my fingers and the bone and the mandible. Here, they are not palpable. Submandibular lymph nodes are 3 to 6 lymph nodes usually, and in our patient they are not palpable. In the other side, the same way. I take his head to the other side, I palpate the submandibular lymph nodes, not palpable. Now the cervical lymph nodes, I keep the sternocleidomastoid muscle relaxed by asking the patient to keep looking forward. And then I palpate the superficial lymph nodes with my fingers following the sternocleidomastoid muscle. These are the superficial lymph nodes of both sides. The superficial lymph nodes. Now I ask the patient to look at the opposite, to the left or to the right. Now he's looking to the left. I am examining the deep cervical lymph nodes. The deep cervical, they are either behind the sternocleidomastoid or in front of the sternocleidomastoid. So with the fingers, I palpate all the way. You can use this way. You can, okay, the other side, please. Nothing is palpable. And at the end, we examine the supraclavicular lymph nodes. The supraclavicular lymph nodes drains the GI tract. If they are enlarged, we need to consider the GI tract. Supraclavicular lymph nodes. Supraclavicular lymph nodes here and there. They are not palpable. Okay, now the glands. We look at the thyroid gland. I go to the sternal notch. Okay, I put my finger in the sternal notch. I go 2 fingers above the sternal notch, like about 2 centimeters above the sternal notch. Here you will find the isthmus, the junction between the 2 lobes of the thyroid glands. Okay, sternal notch, 2 fingers, and then this is the thyroid gland, and this is the isthmus. It is not easy to palpate the normal thyroid gland. رجعها لك هون شوف زي ما كنت. Okay, it is not easy to find it if it is not enlarged or not having asymmetry. In the case of our patient, it is not, and there's no asymmetry, and there's no hyperplasia. There are different ways. Either you just palpate the midline on both sides of the midline. We ask the patient to swallow. Again, the thyroid gland will move while swallowing. Here it is not, as I said, it is not palpable and not obvious. Or you can take all the soft tissue to the other side and you palpate. Okay, you with your fingers push the thyroid to the other side and do the palpation. Okay, this is another way. Now the parotid gland, usually the parotid gland is not, again, you cannot define it clearly by palpation, except if you have parotid gland enlargement. In the case of parotid gland enlargement, you will see asymmetry, and you will see that the lobe of the ear is elevated. If the tail of parotid is enlarged, you'll see this earlobe is elevated. So compare both sides, looking for symmetry, for swelling, and look at the earlobe if it is enlarged or not. Now for the submandibular salivary glands, usually they are palpated while you palpate the submandibular lymph nodes. If you find or you feel any enlargement or hardness while palpating the submandibular area, we need to do more examination. When we do the intraoral examination, we will examine the submandibular lymph manually, from outside and from inside together. We will do that in the demo, the other demo. Okay, and by this we finished the extraoral examination. Thank you, Muhammad.